Have you ever noticed something swimming in your field of vision? It might look like a tiny worm or a transparent blob, and every time you try to focus on it, it disappears, only to reappear the moment you shift your gaze. But don't rush to rinse your eyes. What you're seeing is a common and completely normal phenomenon known as a floater. The scientific name for these objects is muscae volitantes, which is Latin for flying flies. True to their name, they can be a little annoying, but they're not actual bugs or any kind of external object. In fact, they exist inside your eyeball. Floaters might seem alive since they move and change shape, but don't worry, they're not living creatures. Floaters are actually tiny objects that cast shadows on your retina, the light-sensitive tissue at the back of your eye. These objects might be bits of tissue, red blood cells, or clumps of protein. Since they're suspended in the vitreous humor, the gel-like substance filling your eye, they drift along when your eyes move and even seem to bounce a little when your gaze settles. Most of the time, floaters are barely noticeable. However, they become more visible when they're closer to the retina, similar to how a hand held closer to a table under a light casts a sharper shadow. Floaters are especially noticeable when looking at a bright, uniform background, like a blank computer screen, snow, or a clear sky. The smooth, consistent backdrop makes them stand out more. Light intensity also plays a role. The brighter the light, the more your pupil contracts, which works like switching from a soft, diffused light to a single overhead bulb, making shadows clearer. But there's another visual phenomenon that looks similar to floaters, but is completely different. If you've ever seen tiny dots of light darting around when looking at a bright blue sky, you've experienced the blue field entoptic phenomenon. In a way, this is the opposite of floaters. Instead of shadows, you're seeing tiny moving windows, allowing light to pass through to your retina. These windows are actually caused by white blood cells traveling through the capillaries on the surface of your retina. White blood cells are larger than red blood cells, and as they move through a capillary, they create a plasma space in front of them. Since both the plasma space and the white blood cells are more transparent to blue light than the red blood cells around them, we see a moving dot of light following the path of the capillary, even matching the rhythm of our pulse. Under the right conditions, you might even notice a dark tail behind the light dot. That's just the red blood cells bunching up behind the white blood cell as it moves. Some science museums have exhibits with blue light screens that make these blue sky sprites easier to see than usual. While everyone experiences these visual effects, the number and type of floaters or blue field dots can vary greatly. Most of the time, our brains simply learn to ignore them. However, if someone suddenly starts seeing a lot more floaters or very large ones that disrupt vision, it could be a sign of a more serious eye condition that needs immediate medical attention. But for the majority of people, entoptic phenomena like floaters and blue sky sprites serve as a subtle reminder that what we think we see is shaped just as much by our biology and perception as it is by the external world. This was YtEd. Thanks for watching. Don't forget to like, share, and subscribe for more fascinating science.